Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McRae.
Tracy, glaucoma, we'll talk about it today, is the leading cause of preventable blindness in the developed world. There are over 2.5 million people who have glaucoma in the United States, and if you go worldwide, it's about 60 million people. Now, it's a condition of increased pressure in the eyeball that damages the optic nerve, the nerve that goes from the back of your eyeball to your brain so you can actually see. Of course, it's vital to your vision. And when glaucoma happens, it's because of too much pressure in the eyeball. But if you know you have it, it can be treated, and hopefully you can preserve your vision.
Hopefully, yes.
Yep.
January is Glaucoma Awareness Month, and here to discuss the condition is Mayo Clinic ophthalmologist and glaucoma expert, Dr. Arthur Sitt. Welcome to the program, Dr. Sitt. It's nice to see you.
Thank you very much. It's a pleasure to be here today.
So how do you explain glaucoma to your patients?
So it's a really good question, and I think, Tom, you had a very good introduction to what glaucoma is. And it is a disease that affects the optic nerve, which is the cable that carries signals from the eye to the brain so that your brain can interpret what you're seeing. And when that nerve is damaged by a number of factors, pressure being the most important factor that we know of, the nerves that carry those signals are lost, and vision is ultimately impaired. Now, one of the important things to recognize about glaucoma, though, is that the brain and the eye have remarkable adaptive abilities. So you can actually lose about half of these cells in the eye before you actually have loss of vision.
Half of the cells in the cable, in the nerve? Wow.
Exactly. And that's why it's really important for patients to get their eyes checked, because you can actually have significant damage before you would ever notice anything.
Yeah, that's the key. You can't feel glaucoma is happening. There's no way for you to actually just tell that that's happening.
Absolutely. So it's called the silent thief of night because, or the thief in the night, because it comes and takes your vision, and you don't really know that it's happening until it's very, very late. So that's why regular eye checks are important.
What causes glaucoma? Is it hereditary?
So that's a great question. So there certainly are hereditary factors. If your immediate family members have glaucoma, you're at increased risk for glaucoma. Certain ethnicities, such as African Americans and Latinos, tend to have higher rates of glaucoma. So if you have family members that you know of who have glaucoma, certainly you should be even more vigilant about getting your eyes checked. In terms of what actually causes it, that's also a very good question. We don't know all the things that cause it. We know that pressure is very important, and that's really what we treat right now. But even pressure, a lot of patients get glaucoma at what would be considered a normal pressure. So we actually don't like to talk about normal pressure. There's a pressure that most people have, but you can get glaucoma at any pressure. It's whatever your particular eye can tolerate.
So at this stage of the game, you can't cure glaucoma. You control it?
That's correct.
Okay.
So we can't cure it, and we do have a lot of treatments to control it. And in most patients, we can control it well enough so that you can maintain useful vision throughout your life.
So when someone goes into the eye doctor, how do you check their pressure? It's a relatively simple test, I think. And can you also tell if there's been any damage to the nerve by looking inside the eye?
Yes, you can. So checking the pressure is relatively simple. There's a number of different ways that we can check the pressure. Sometimes there's an air puff, which doesn't require any anesthetic eye drops. There's something called
air puff, did you say?
That's correct. So
people don't like it.
Really?
I'll tell you that much.
Yeah, if you've had it, you'd know about it.
I thought they put that little thing on your eyeball.
Yep.
But that requires a little anesthetic.
That's right. A little anesthetic eye drop. That is it's an eye drop. So but it's very quick, and we place a little device called an applanation tonometer on the surface of the eye. And that allows us to measure the pressure. And there's a number of different techniques that can be used for screening pressures as well.
And also, if you look at the nerve through a slit lamp, you can tell if it's been damaged by the increased pressure?
Absolutely. And that is really critical because, as I mentioned, you can get glaucoma at any pressure. So even if your pressure is similar to someone else's pressure and within what would be considered a normal range, it doesn't mean that you're not at risk for glaucoma. So you have to, when you go and see your eye doctor, it's critical that they dilate your eyes and look at the nerve to see whether there's already damage there.
If there has been damage, can it be reversed? Can it be healed, or is it done?
It's done, unfortunately. The eye it's really part of the brain, and the brain doesn't regenerate once we get into adulthood, and the eye doesn't regenerate once we get into adulthood. So the key is to catch the disease early so that we can treat it and prevent as much as possible further damage.
Do you ever see glaucoma in children?
Glaucoma does occur in children. Fortunately, it's not common, but it definitely can occur in children, and it tends to be a very severe disease when it occurs in children. Children, obviously, infants anyway, can't tell us if they're having vision problems, so it's important for pediatricians and family doctors and parents to be on the lookout for symptoms of children and infants.
It is, and that's why Glaucoma Awareness Month is wonderful, because it highlights the fact that you really do need to get an eye exam. Even if you think your eyes are just fine, it's really important.
Absolutely, and getting those regular eye checks really are the key, and particularly if you're in an at-risk group, such as family members with the disease, or if you're in a high-risk ethnicity, or if you're older. So glaucoma definitely is more common as we age.
All right. So we've made the diagnosis. It's glaucoma. How do we get the pressure down?
So the most common thing is to give eye drops, and eye drops tend to be very well tolerated for most patients. We give it once or twice a day usually, and for the large majority of patients, that's all that's required, eye drops. Now, there are some patients where that's not enough, and another option would be to do laser. The laser is done in the office, and it's very quick and simple to do. It takes probably about 10 minutes.
And what does that do?
So what that does is we apply the laser to the drainage areas of the eye called the trabecular meshwork. That's where the fluid drains out of the eye. And the laser helps the eye to clean up some of the blockage that's there, to lower the pressure down.
Improve the drainage.
Exactly.
All right.
And because it is so easy and quick, some ophthalmologists will advocate using the laser earlier, sometimes even before eye drops, depending on patient preferences.
Wow. We have about 90 seconds to go here. Explain what sort of research is being done on glaucoma at Mayo Clinic.
So there's a lot of research. So our research here at Mayo Clinic spans from trying to discover new medications to treat glaucoma, trying to understand better the underlying causes of glaucoma. As I mentioned, we know some of the things that contribute to risk for glaucoma. We actually don't know what causes it. Why does one person with a normal pressure have normal eyes, and another person with normal pressures have glaucoma? So we're trying to understand these factors both from a mechanical standpoint as well as a genetic standpoint, and understand better the outflow of fluid from the eye.
Glaucoma. We've learned that it's the leading cause of preventable blindness in the developed world. You've told us that it's important to make the diagnosis early before there's damage to the optic nerve. And you've also told us that the eyeball is really a part of the brain. So we could call you a brain surgeon in addition to being an ophthalmologist.
Absolutely. We actually like to think of the brain as part of the eye.
Oh, nice. Very good.
Arthur Sitt, eye specialist, Mayo Clinic. Thanks so much for being with us.
Thank you very much. It's a pleasure.